Frontline workers all over the world are risking their lives to help others during the COVID-19 pandemic. In Yemen, doctors are struggling with the additional burden of a healthcare sector that's collapsed due to years of civil war. With a shortage of basic hospital supplies, many medical staff have lost their lives trying to care for others. Obaida Hitto has more.
Saeed bin Humam's father, Mohsen, died earlier this year after a painful struggle with the coronavirus. He explains how his father went from being the doctor to the patient.
At the beginning of February, my father had a fever and started coughing. His condition worsened within days. He wasn't even able to drink water. He tested positive for COVID-19 and was quarantined, and then finally admitted to hospital. His last days were in the ICU as he had kidney failure.
Health ministry officials say Dr. Mohsen bin Humam is one of at least 166 medical workers in Yemen who've died of the coronavirus. Amjad Saleh says he was worried about his father-in-law because he was exposed to the virus on a daily basis.
When he tested positive, the doctors didn't tell him the results. He was a doctor himself. He knew the symptoms. I used to tell him that he risked contracting COVID-19 because he was treating coronavirus patients, but he said he would be fine.
Mohsen was the director of the isolation center at Al Jumhuriya Hospital in Yemen's port city of Aden. His colleagues remember him fondly, but have little time to mourn.
The pandemic is beyond our scope of capabilities. Many doctors lost their lives to the coronavirus. Dr. Mohsen was a good physician to depend on during hard times. His death is a big loss. Many patients recovered from the virus thanks to his treatment.
The UN has described Yemen as the world's worst humanitarian crisis, with more than 21 million people in need of aid. With a crumbling health sector, frontline workers are among those at greatest risk of contracting COVID-19.
The virus largely spread among doctors and paramedics. That's because of the shortages in protective personal equipment and the lack of experience in dealing with the pandemic. The doctors on the front lines are the main victims, whether they're working in the southern or northern governorates.
According to Johns Hopkins University figures, there are about 7,000 confirmed cases of COVID-19 in Yemen, a relatively low number in comparison to other countries in the Middle East. But with more than 1,500 deaths, it means that around 21% of all Yemenis who contract the virus die, a situation spiraling out of control as the country runs short of even the most basic medical supplies. Hospital officials are pleading for international support so other doctors don't face the same fate as Mohsen bin Humam. Obaida Hitto, TRT World.